Hey everybody, Luke Gordon, physical therapist with Gordon Physical Therapy. If you have had a concussion or you're post-concussion right now and you're looking for treatment, I want to tell you all about how we treat people with concussions at our physical therapy clinic. So there's 5 areas that we focus on with our treatments. The first one is exercise therapy. I'm going off my list here, so if you see me looking down, that's why. So exercise therapy. In general, with a concussion, a lot of people are told just kind of blanket information just to rest. And sometimes that's good information for the first, 48 hours or so, but oftentimes people are resting too long and they actually need help figuring out the right type of exercise and how to grade it appropriately to not make their symptoms worse. So that's a really big focus of concussion treatment when we're helping people figure out how to reintroduce exercise, especially if you're trying to get back to a sport or an activity or even work. We've got to ramp up that activity level and make sure that you're not just resting and hoping that it improves on its own, because it won't always do that. So that's the first area, exercise therapy. The second one then is manual therapy. So if you've got a lot of neck pain associated with your concussion, maybe you had a whiplash, you're in a sporting accident or a car accident, now you've got pain throughout your neck and stiffness, we're going to help that with manual therapy, meaning hands-on therapy. So we're working on the joints, soft tissue, muscles. There's also some craniosacral work that goes into that, which I won't go into detail on what that is, but it's just another type of manual technique to help realign everything and get everything feeling better. So that's number 2. The third area of treatment then for concussion is going to be visual and vestibular. So if you've had some visual disturbances and you're having some dizziness, lightheadedness, vertigo, things like that, then we're going to work on that. And basically, we're just trying to reestablish a better communication between your eyes and your brain. So there's certain exercises we're going to do, there's maneuvers we're going to do to help you reestablish that link and just take care of some of those, again, eye and vestibular symptoms. So that's the third area. The fourth area, lots of education and just reassurance. So we're going to educate you on just the overall disease process of a concussion, what you can expect going forward, education on the exercise progression, treatment progression, and then things like sleep and diet and stress and anxiety, which I talked about that in a different video. We're talking about different symptoms that you're probably dealing with a concussion. You want to just know more about them so you know that they're normal and you know what to expect with ongoing treatment. So that's a big part of it, is education and reassurance. And then the fifth area that we'll address is diet and nutrition, especially for folks that their concussion symptoms are lingering. You're having post-concussion syndrome now, where we need to kind of ramp it up and take it to the next notch. We're going to look more at, again, dietary nutrition changes and upgrades. So hydration is key for this one. I'll make a whole video about this as well, but I want to just kind of go off the bullet points here real quick. Lowering your carb and sugar intake, especially refined sugar. Increasing protein, vegetables, and good fats. That's going to help your brain heal more quickly. And then avoiding alcohol, unfortunately, has to happen sometimes with recovery. And then for some people who really still just aren't responding, we're going to look at potentially doing a gluten-free diet for at least 4 weeks and to see if that helps calm down some of their symptoms. So again, if you're looking for concussion treatment in Spokane Valley, Washington, obviously we can help you here at the clinic. And if not, I hope that this helps you kind of figure out those areas that you need to focus on. So again, there's the 5 areas: exercise therapy, manual therapy, visual and vestibular, education and reassurance, and then diet and nutrition. So again, we'd love to help you here at Gordon Physical Therapy. If you're anywhere nearby us here in Spokane Valley, my name is Luke Gordon. I'm the owner of the clinic here. Thank you for watching. If you have any questions, reach out to us anytime. Thank you.